Thank you. Thank you, everyone, for signing in. Welcome to tonight's event. I'm Julie Lindo, Associate Director of San Francisco Bay Physicians for Social Responsibility. Tonight's webinar is titled, What Plastic is Doing to Your Patients and You, with SF Bay PSR member, Dr. Barbara Erny. And now a little more about our Expert Perspective series. It's designed to help you learn about the effects of climate change, nuclear industry, and militarism, and environmental degradation on patient health. SFBay PSR's board and committee members will share their expertise, representing a wide range of medical specialties and offering the chance to ask questions and discuss how we can work together and protect public health. We hope you will stay connected with us via social media, our newsletter, action alerts, by becoming a donor or joining one of our committees. We will post info in the chat. And now it's my honor to introduce our speaker. Dr. Barbara Erny is a Bay Area native who grew up in Cupertino when it was the Valley of Heart's Delight. After earning her BA at Cornell University, she returned to Stanford for both medical school and residency training, then spent over 25 years as a board-certified ophthalmologist at Sutter Health. A longtime PSR member and a familiar face on our SF Bay PSR Environmental Health Committee, Dr. Erny has channeled that commitment into her academic work at Stanford. At Stanford, she's an adjunct clinical associate professor of medicine and a faculty fellow with the Center for Innovation in Global Health. She's a founding member of Stanford's Climate Learning Initiative in Medical Education, leading efforts to integrate climate and environmental health into medical school curricula. And she's a curricula and physician training at every level, She extends this work through the Global Consortium of Climate Change Education and serves on the editorial board of the Journal of Climate Change and Health. Dr. Erny is also a co-founder and advisory board member of iSustain, a global initiative dedicated to reducing waste in ophthalmology. And fun fact, she's a docent at Edgewood Park in Redwood City. And now it's my pleasure to hand the mic to Dr. Barbara Erny.
Thank you, Julie. Thank you, Julie. Can everyone see my screen? Okay.
Yes, that looks good.
Thank you all. So today I'm here to talk to you about what plastic's doing to your patients and you. And as we know, it's kind of traditional for us to have a headshot to start our talks on our title slide. So many of you know what I look like on the outside, but I figured I'd show you what I look like inside my head today. And it's pretty scary. I have no financial disclosures, and I'm going to share with you that we all have maybe a spoonful of plastic in our brains. When samples of brain, liver, and kidney tissue were taken from cadavers who died recently from 2016 to 2024, comparing them with older samples from 1997 to 2013, those tissues had much higher levels of plastic in the newer tissue samples, and the brain tissue had much higher microplastic and nanoplastic levels than liver or kidney. On average, the brain tissue from adults contained about 4,800 micrograms of plastic per gram of tissue, roughly the mass of a plastic spoon. And it's not just benign particles as claimed by industry. The dominant plastic was polyethylene, in the form of tiny shard-like fragments, not smooth beads. These micro and nanoplastic levels in the brain and liver increased significantly between 2016 and 2024. And the brains from people with dementia had 3 to 5 times higher levels than those without dementia. So what is up with that? Why is it accumulating faster in our brains where we have a blood-brain barrier than our other organs? I don't know the answer, but at the conclusion of this activity, hopefully you'll know some answers and be able to assess the magnitude of plastic use and waste generation in healthcare settings and evaluate how it causes both direct and indirect harms to human health. Identify the human health risks associated with microplastic exposure, including mechanism of cardiovascular disease, inflammation, and endocrine disruption in both patients and healthcare workers. Implement evidence-based strategies to reduce plastic consumption in your daily life and clinical practice while maintaining patient safety and care quality. So first, starting with our plastic planet, which many of you are sadly familiar with, we have not over 9 billion tons of plastic manufactured since 1950. That's more than a ton for every one of us. And more than 1 million plastic water bottles are sold every minute. I always wonder how we all didn't die of dehydration 20 years ago. For every person on the planet, there are 21,000 pieces of plastic floating in the ocean, or more, really, because they keep breaking down into smaller pieces. And 40% of our ocean surface is now covered in plastic. And sadly, production is increasing exponentially. Most people I ask think that plastic production's leveled off or will go down, but no, it is still increasing exponentially. And we're just flooding with plastic waste from all sorts of reasons. Packaging, vehicles, textiles, everything is accumulating. And it looks like in 2040, at the rate we're going, the amount of plastic production will double. And by 2060, it's predicted to triple if we don't change something soon. And plastic just breaks down into our environment. It just keeps getting smaller and smaller. So it never goes away. It just keeps getting smaller, and it's pretty ubiquitous. It just becomes smaller forever. And it's not just about the garbage with this plastic. There's a whole plastic life cycle that's very toxic to all of us. And that includes the extraction of the raw materials, the petroleum products that plastic is made out of, the manufacturers of those resins and the fabrication leading to the end product, packaging that's needed. And a lot of the packaging of plastic is plastic. Distribution, transportation with gas and oil. Sometimes plastics are reused, but we know that that's not necessarily good because it breaks down and we can ingest it when we reuse it. And most of it goes to the landfill. Less than 10% of our plastic in the US is actually recycled. And the recycling is kind of an issue in itself because even with that little amount we recycle, the recycling process is quite toxic and energy intensive. And people might feel good about drinking out of a Coke bottle that says it's 100% recycled plastic, but most recycled plastic is actually more toxic to our health than the virgin plastic itself. It's everywhere. It's getting into our air, our soil, our water, and ultimately our food. On land, we know it's in the air. It's then absorbed into the soil, into the groundwater, and then grows into all of our plants and gets into our grazing land animals. In the ocean, it's also getting onto the surface, breaking up with UV light, especially and weathering into more and more micro and nanoparticles, even getting eventually to the ocean floor and also into our fish and seafood supply. And then it gets into our bodies. So several different ways we can be ingesting it through the food I just mentioned that is getting plastic into it. Beverages, just inadvertent oral contact. We've got inhalation of all the plastic particles in the air, both indoor, outdoor, and occupational inhalation for people that work in highly polluted environments, and even transdermal through our beauty products, our clothing, our watch bands, our arts and crafts, things, kids are doing, tattoo ink, all sorts of ways we're getting plastic into our bodies. And the size matters of these plastics. We have the size of micro and nanoplastics described here, and they get very, very small. Width of a strand of DNA is compared to some of these nanoplastics. These are respirable. So we have the inhaled fraction of plastics, some of which are large enough to lodge in our lung tissue, and others small enough to be passing through our lungs and into our bloodstream. Some estimates, there are a lot of different estimates on how much we're inhaling per day, but there's a latest estimate of 71,000 particles per day, with the vast majority being nanoplastic. We can measure these nano and microplastics with measuring devices that are found in laboratories. There's all sorts of ways to do this now. And Dr. Kari Nadeau, who used to be at Stanford, then at Harvard, and is now dean of the public health school at UCLA, our colleague, she had an LIDR laser blood sampling machine in her lab at Harvard, and she tested her own blood, and all of these little particles you see that look like little fragments swimming around in there of different colors are all different chemicals and associated with those shards of plastic. You can see on the right, there's several, many chemicals that are in this plastic in her blood, and she was horrified. And she decided she was going to get a water filter. She thought the water she was drinking was safe. It was rated by the government as safe. But she significantly reduced her plastic load after getting a water filter. And of course, I mentioned, you saw the big list of chemicals. These are not inert or benign particles, as industry would like you to believe and has told us for all these years. Many of you are familiar with these BPA phthalates. Those are pretty well-known chemicals, styrenes, PCBs, all these things have chemical ingredients. Some cause chemical byproducts. And many of these marine plastic debris, these shards of plastic or microplastic shards, they are roughed edged and pathogens actually stick to them too. So not just their chemical makeup, but they are absorbing other pathogens onto them. And they get into our blood, as I mentioned, through the lungs and through other methods. And these micro and nanoplastics are affecting our blood and bone marrow in various ways. They're causing oxidative stress, leading to DNA damage and stem cell dysfunction, chronic inflammation with persistent immune activation, which of course leads to cancer risk, as we know, stem cell inhibition with reduced blood cell production. They can also cause hemolysis of red blood cells when the microplastics absorb to the surface. There's metabolic disruption with impaired energy production and cell division, premature aging of these bone cells once it gets in the marrow, the gut-marrow axis with the microbiome actually changing the effect of hematopoiesis, and toxic carriers of BPA and phthalates adding cancer risk. Microplastics, and many of you I know are familiar with this article that came out by Marfella and others in 2024, finding that microplastics in carotid plaques increase the risk of heart attack, stroke, and death by 4.5 times over 3 years in heart disease patients. These microplastics are present in the atheromas, contributing to the inflammatory and oxidative stress linked to cardiovascular disease. And of course, endocrine disruption, as most of you are physicians, you're well aware, but I know some other people may be watching this talk. So when these plastics are absorbed into the body, it can become an endocrine disruptor, and that can decrease or increase normal hormone levels, mimic the body's natural hormones, or even alter the natural production of hormones. Again, this is associated with breast cancer, many other hormone-sensitive cancers and diseases. And just a latest paper has come out. It's still online. It's just come out from NYU with, of course, Leo Trisande, who's very well known of studying these chemicals and toxins in our environment, linking preterm births to DEHP, which is commonly found in our IV tubing, looking at almost 2 million preterm births they think is related to DEHP plastic percentage of global preterm births may be above 8% related to plastic exposures. And they're linking neonatal deaths to this too. And the irony is when we have a preemie born, they are just full of tubing, and 70% of our IV tubing in the US contains DEHP. Of course, the plastics impact the reproductive health even before the baby's born in the parents, leading to systemic inflammation, which can lead to infertility and complications in pregnancy. As I mentioned, endocrine disruption, which affects fertility, the quality of the eggs, and sperm counts, which, as we all know, have been going down. And widespread exposure in the parents found in human breast milk, placentas, and then the fetal livers, kidneys, and testicles. So this is impacting reproductive health from sperm and eggs to the fetus itself. These babies now are born pre-polluted with plastic. We can see in our blood and organs that is because 100% of placental samples in the US were found to have microplastics, and the babies born themselves, their meconium had plastic in 100% of babies tested born in the US. Our lungs, which I mentioned before, those microplastic particles actually getting stuck in the lungs quite a bit. 90% of human blood samples have been found to contain plastic. It's disrupting our skin with inflammation and breaching our skin barrier. And of course, the brain, that significant accumulation, especially in individuals with dementia and neurologic conditions. Again, here's our spoonful in our brain. Also, Dr. Tresande has had a paper published a couple years ago now on phthalates and mortality, looking at cost analysis. So not only cost in lives and in health, but also monetary costs. So, if this is not a concern to our politicians or whoever, that there may be health ramifications, there is certainly financial ramifications. Societal costs approximating 39 billion a year or more, according to their study. And of course, it's a health equity issue as well as a biologic health issue. Our patients living in under-resourced communities that maybe live near freeways with tire dust, which is a major contributor to nanoplastics and microplastics in the air. They might be drinking contaminated groundwater from their tap or buying bottled plastic water bottles because they fear that their tap water is unsafe. Many of them live near landfills or exposed to much plastic there, or are rifling through garbage in landfills because they have no other means to find food and supplies. Many have poor ventilation in their housing, can't afford air filters. They're exposed to other climate stressors, exacerbating the problem. Or they live in food deserts with a lot of plastic packaged food, or of course have to work or live near oil drilling and plastic production plants and incinerators. Plastics, as we know, also contribute to climate change through deforestation and production and manufacturing, extraction and refinement, and of course through plastic waste. 91% ends up in our landfills, incinerators, or natural environments of the plastic we produce in the US. These landfills that it gets dumped in to generate methane, a greenhouse gas 80 times more potent than CO2 when produced. And of course, the plastic pollution in the oceans and soil interfere with their capacity to absorb and sequester carbon dioxide, besides what I mentioned before about affecting our food chain system. And as I think all of us here in this talk know, climate change has been declared the biggest health threat of the 21st century, and plastic is contributing to that threat. Planetary health, of course, is human health. So whatever we're doing to the planet, we are doing to ourselves with food security. Again, plastic getting into the fish and the food chain, in the plants even we eat, especially in the meat. Creating disease are my colleague Desiree LeBeau at Stanford, going to Kenya, realizing that even though it was a drought, the increase in mosquito vector-borne diseases were increasing there, and realized it was from all the plastic bottles with droplets of water providing a perfect breeding ground for these mosquitoes. Of course, we have these plastics I mentioned, those rough edges attracting hydrophobic pollutants and pathogens, and the air hazards from the burned plastic trash, which in many developing countries is routine to just burn plastic even to keep warm, causing, of course, pulmonary problems and even death. So we're going to have you answer in the chat, and Julie's going to take a look at it. What is the one thing that bothers you the most about the plastic waste you see in your hospital or office? So get you thinking and riled up a little bit about what bothers you the most that you see in your hospital or office. Julie, do you have
Yes, I'm seeing plastic gloves, improper waste sorting. Um, oh, it's coming in quickly. Let's see. Stop. People's lack of concern or lack of consciousness about waste, how pervasive this is. It feels that we sometimes feels that we cannot reverse the course.
Okay, the one thing you're going to write down, the one thing that really bothers you the most. So I think you all have a lot of things that bother you, but yeah, maybe it's gloves, maybe it's disposable gowns, the red bags overflowing with inappropriate garbage. Well, I'll tell you something that really bothered me. My father-in-law was admitted to Kaiser. I will admit it was Kaiser. I already said it. Kaiser, one of the Kaisers after his stroke, and I came in to visit him, and he had a lunch full of plastic, a plastic cup of ice with a plastic pitcher of water and a plastic water bottle, fruit in plastic, yogurt in plastic. It was all in plastic. Now he had, besides being 80, he had no other risk factors for a stroke. He was reasonably slim. He was active walking every day. His cholesterol was a low 150. He had no real reason except age. What if it was the plastic in his arteries, you know? I mean, and they're giving him a lunch basically of plastic. So that bothered me a lot. And another thing is, as I mentioned before, 70% of our IV bags and tubing in the US contain PVC softened with DEHP. This leaches into the fluids, is directly absorbed into the body, and is not only an endocrine disruptor, but a carcinogen. So the irony is we have cancer patients receiving chemotherapy through carcinogenic plastic tubing, which leaches into the chemo into their blood, and it actually interferes with the chemo treatment. It makes most drugs less efficacious. It also contributes to ADHD, obesity, and type 2 diabetes, and cancers. And again, what is this doing to our preemies with the high load they're getting in their little bodies with all that tubing? We also have direct harm to healthcare workers. So contact with plastic and PFAS are forever chemicals that are found in gloves. Those are absorbed into the skin. There's also, chemicals used, the PFAS, there are chemicals used for their water repellent properties. They also accumulate in human tissues in the environment and don't break down naturally. Just like plastic, they cause cancer, endocrine disruption, immune system suppression, and reproductive harm. They're found, plastics and PFAS, in PPE and our surgical drapes, tubing, and the gloves that I've noticed are worn much more frequently than they were before COVID. And studies are showing that are actually transmitting more pathogens to the patients because people get lazy about changing them when they used to just wash their hands between everything. And there's the impact of our healthcare system on health also. So no news here to most of you. Almost 10% of our global greenhouse gas is coming from hospitals. But a lot of that is from the almost 6 million tons of plastic waste produced per year by hospitals, which about a third comes from the OR. And of that, about 20 to 25% of the waste we produce in healthcare is plastic. And that's of the 14,000 tons of total waste daily, about a quarter is plastic. So that adds up to about 1.5 million tons per year. And about 85% of this waste is non-infectious, but still discarded as medical waste. Less than 5% is recycled. And every hospital patient generates about 10.7 pounds of waste per day, much of that being plastic. Without change, estimates show that this will probably increase 35 to 40% by 2040. And what's the breakdown of our healthcare waste as in categories? This sterilization wrap, often known as blue wrap, this accounts for about 20% of all OR waste. Gowns and drapes, over 80% of the gowns and drapes in the US are single-use or disposable now, post-COVID. Gloves is one of the highest volume items, billions of pairs disposed of annually in the US. And the plastic packaging itself, so many products, the packaging is plastic, and that makes up about 25% of the daily hospital trash. And then there's the incineration, which not too much is done at our hospitals now, thanks to Practice Green Health, but still any plastic incineration or burning releases dioxins, causing respiratory damage, immune suppression, and cancer. PFAS, which is released during plastic combustion. Benzenes and VOCs, which are known to cause lung disease and cancer. And of course, smoke itself, which leads to asthma, pulmonary disease, and even decreased lung function in healthy people. But the US can do better in healthcare. We can do better. I have been to Aravind Eye Care System in India, which is actually leading the world in being sustainable and high quality. And we have this much on the left. You can see this much garbage generated by one cataract phaco emulsification eye operation in the US versus 93 of the exact same procedure at Aravind in India. And that is astounding. And they actually have a lower infection rate than the US and the UK. These studies have been verified. There's been Americans down there involved in these studies, and they have a whole system down where they reuse everything, they recycle everything they can, and they are obviously doing it well, and things are remaining sterile. But you know what? Do our colleagues care? I mean, I think all of you here today care because you're here. But, you know, I think someone mentioned in the chat earlier, people don't care. But we found out at least ophthalmologists and some of our OR nurses do care. So a few years ago, my colleagues did a survey of cataract surgeons and nurses' attitudes toward operating room waste. And 90% were concerned about climate change due to the waste. Almost 60% very concerned. Over 93% found the OR trash excessive, most of them far too much. And I don't know who the 5% that thought it was appropriate were, but not many, thankfully. 93% agreed we should seek approaches to reduce waste. And 78% said seek ways to reuse instruments and supplies. And again, that 5% said no changes needed. So our colleagues do care, at least in ophthalmology, we found out that they do, and our nurses care also. So we started something called Eye Sustain, which is a global coalition of eye societies, organizations, and ophthalmologists collaborating to make ophthalmic care and surgery more sustainable. I haven't updated the slides since my meeting about a week ago in Washington. Now over 58 societies worldwide have joined us. So the All India Ophthalmology, China Ophthalmology, European Society of Cataract Surgeons, just These are 58 societies of big ophthalmology societies worldwide, including our biggest society in the world, the American Academy of Ophthalmology, which is one of our sponsors. So you might check it out because even though it is made for ophthalmology, there's a lot of tips on the website that can be used in other specialties, especially surgical. Our website topics include sustainability in the clinic, so that may apply to many of you. Sustainability in the OR, again, a lot of it is for any OR. And drug waste, we have our own particular drug waste, which is eye drops, but you might have other drug waste. What's happened with eye drops and a great story of how one person can make a big difference is many patients in the operating room, they were getting a drop of maybe an antibiotic in their case. Then the OR was throwing away that bottle, giving the patient a prescription to go to a pharmacy after surgery and buy a bottle, some of which can be without insurance over $100. And this seemed insane to our ophthalmologists, like they're throwing away this drug the patient already paid for with their surgical cost and then had to go buy it. So our iSustain member, Dr. Palmer in Illinois, he went to find out why is this happening? What is this a law? Is this a recommendation? Is this just a bad practice? Turned out it was an Illinois state pharmacy law, and he got it changed. And now many states have changed their laws. I think California, it's already legal, but many states followed, many ophthalmologists followed to fight in their states. So one person has made a big change. So always remember, anything you do could start a whole national movement. And iSustain also collaborates with industry. So, we might think that they are only out to sell single-use everything and make a lot of money. And, they do make more money, but we have had some successful initiatives with industry. Dr. Chang here who is a adjunct at UCSF and practices in my community, and another co-leader of iSustain with me, showing the paper IFU that came in every single box with a cataract intraocular lens in the world. And this is in about 50 languages. No one ever reads it. If they do, they read it once in their life. And it was getting thrown away with every single box. And we worked with industry who doesn't want to be in the paper business either. And now in almost every country in the world, it's an electronic IFU for cataract IOL boxes, which is really important because in the US alone, we have over 4 million cataract operations a year. Now we're starting to get into it with them about some things that they want to have single use and we want to have reusable that are plastic, but I think we're going to win because we are the customer. And I think we all have to remember that when we're talking to our reps and industry, they need us. We're the customer and we have a lot of influence on what we buy and who else buys it in our specialties. And we have iSustain members who are inventing solutions to these issues. There's a new machine that has been invented to sterilize eye drop bottles in the office because some people are concerned that a dropper might get contaminated with normal use, which is not the case, but there's concern about that with regulators. So this uses UV light to sterilize the eye drop bottle after each use. What just passed last week in our meeting, which was such good news, is that our lenses we use in the clinic that we used to just clean with alcohol and it seemed to be fine, now have to be either thrown away with each use or cleaned with a very toxic bleach solution that actually ruins the lenses pretty fast and is bad for the environment. So now this has been approved to sterilize our lenses and other equipment. So that's been really exciting news that came out last week. There's also a company that puts this little attachment on an eye drop bottle to reduce the eye drop size, saving patients and operating rooms, clinics. They get about 3 times as many drops out of the bottle. Now, why is the eye drop size too big to begin with? The drop it makes is actually the correct size for the eyeball because the eye only holds about 7 microliters of fluid. So all the eyedroppers out there have a hole that's much bigger than it needs to be, and much of the drop is wasted, or patients get a lot of side effects because they're putting in too much drop, or it runs down their skin and irritates their skin. So we also have this dropper that industry, a startup, came up with. And so we do have industry that are trying to be green, trying to come up with sustainable solutions. And iSustain also has a pledge, which it can be used probably for any OR and just great ideas for all of us in clinic or the operating room to educate your surgeons and staff about sustainability and the impact of OR waste. Regularly reevaluate your surgical pack and use multi-dose bottles of, as I mentioned, the eye drop bottles, using the same bottle on multiple patients when possible, and not throwing away a bottle of drops after one patient. Assess the necessity for patient gowns. So in eye surgery, you're just operating on the eye, and half the people in the surgeons in the US cover the entire body, including the feet, with a drape for an eyeball surgery. It's insane. So we're asking people to assess the necessity for that, because it's been shown in studies it is absolutely not necessary. Reassessing options for reusable versus single-use products and instrumentation, which sometimes requires some studies to prove that the regulators just made up a ridiculous rule, or the industry. Assess the feasibility of alcohol-based surgical scrub, which I had changed to many, many years ago, and actually was better for my skin than scrubbing with the soap every time. The recycling strategies, that's iffy. We know recycling is not great anyway, and what we really need to do is reduce our production and use of the plastic. I also wanted to go into tonight, because we have time, is how laboratories impact the environment. So in case you're an academic with a lab or know people that use the laboratory, scientific labs, medical labs use about 4 times as much water in office space of the same size footprint. Labs typically use 40 to 60% of campus energy if they're on an academic campus, but only take up 5 to 20% of the total space. Labs use up to 10 times as much electricity compared to office or commercial space, and produce about 20 billion pounds of plastic waste per year. So the labs we have at Stanford, UCSF, and academic centers have quite an impact on the environment, even more than some parts of the hospitals. And we have some tips for reducing lab energy use. So ultra-low freezers can be set to 70 instead of minus 80 degrees C. This is shown to be safe and effective, and can save up to 40% of energy just by 10 degrees. And most samples can be safely stored at this temperatures. Keeping freezers clear of the ice buildup, disposing outdated samples, maintaining freezer inventories is all helpful, and keeping those filters and coils clean and free of obstructions. With the fume hoods, you want to close your variable speed fume hood when not in use, and hibernate unused or unneeded fume hoods. Consider green alternatives when replacing or upgrading equipment. This could improve your energy efficiency by greater than 70%. Unplug instruments when not in use. That's a good rule for at home or in your office too. Cut that phantom load from appliances that are not in use but still draw power. You can cut about 10% of your total lab energy use. And for labs, though, we do want some recycling to go on, because that's maybe our only choice for certain products, besides, repurposing, reusing, rethinking. All those things are great, but sometimes recycling is the best option. For single-use plastics and gloves, there's a agency called Polycarbon. You can partner with them for closed-loop recycling with tracking metrics of your gloves. For functional equipment, you can donate via BioLink Depot, which is free, or list them on the Reapply Marketplace. And for electronics and e-waste, there are several ways to dispose of that in communities, but there's next step, which is HIPAA compliant and quick light recycling for hazardous material handling. Sorry, I have an extra eye on HIPAA, I think. For lab and glass plastics, you can drop them off for free in San Francisco at Scrap. So to get more information, there's My Green Lab, there's the International Institute for Sustainable Laboratories. Stanford has some Sustainable Stanford information at Sustainable Stanford, and I'm not quite sure what else might be at UCSF for you. But these are all several avenues to deal with your lab waste. And in 2022, UCSF became the first educational institution to partner with Polycarbon for lab plastics recycling. So that's a kudos to you. Also, UCSF started the 2-week challenge. So I believe the story is the resident in neurosurgery decided to do a 2-week waste audit in the neurosurgical ORs and checking every surgeon's packs, what people actually used. And she found no correlation between a surgeon's experience and the amount of wasted supplies, but a lot of waste from everyone. Sponges, blue towels, and gloves ranked among the most unused and discarded supplies. Once the neurosurgical ORs really went through and only put in the packs what they really needed, which means if you use it less than 66% of the time, to package it as a separate item and not open it automatically for every case. The UCSF neurosurgery department saved $2.9 million per year. So do those audits and tell your supplier exactly what you want in your packs and packaging. Again, you're the customer here. You can get your packs made as you wish for your even individual surgeons sometimes if they do a high volume. So how can you get started? We can get started measuring and reducing your plastics in healthcare with Healthcare Without Harm. And you can check out if you want to scan that QR code or just realizing they have a whole guide to measuring and reducing plastics in the healthcare sector. And it also, you can save costs. Practice Green Health, which your institution may be using already, to help guide your institution on how to change things. You can get their sustainable procurement guide because supply chain is about over 70% of our greenhouse gas emissions, and it also is a lot of our plastic is in supply chain. But you can see that there's all sorts of ways, not just reducing the plastics, but all sorts of ways to save money by being more efficient and reducing plastics. Some hospitals that pursue these programs have an annual savings of $56,000 per OR. And of course, here's our colleague, Dr. Todd Sack, who started the nonprofit My Green Doctor, mygreendoctor.org. You can find out things about practice management, green purchasing, coaching and consulting, and even doing speaking engagements as a physician or healthcare provider who's used My Green Doctor. And this is great for clinic. So if you've got your own clinic, this is a wonderful resource. So what have you done at work to reduce your plastic use and exposure? So we want to put that in the chat again with them. If you've done anything in particular at work to reduce your plastic work use and exposure. And Julie's going to report out what she sees in the chat in a few seconds.
Oh, I know some of you have done some things. Less glove use, reducing use of gloves. Is that it?
How about getting rid of plastic water bottles for patients, like plastic bottled water, putting composting in your break room, just anything like that.
Talking to colleagues. Getting rid of plastic cups.
Great. Well, I talked to a friend of mine in an ophthalmology office. I just said, I'm working on this, reducing plastics. And she went back to her office that week and got rid of stopped giving out plastic bottled water to the patients and put in a water dispenser in her office. So even that was a big, big step, protect our patients and our office workers. Of course, you can, putting in compost bins in your break rooms for the food waste and in your bathrooms for the paper towels. That is great. I think, if you're in a community that takes industrial composting, that's a wonderful, helpful solution with recycling. At least aluminum and cardboard and paper are really, important to try to recycle. And a lot of things still come in cardboard, and emphasizing that the landfill section of your garbage should be the smallest one, hopefully, going through those waste audits. And I'm showing a picture of what looks like a, kind of a I'm not a plastic, a reusable bag. Sometimes those are thermally sealed little coolers or bags. So Stanford started working with some of the suppliers that rather than constantly delivering things in cardboard boxes or plastic wrap, to take it back like some of the food delivery services do, like bring it in this reusable bag, and then the customer gives the bag back and continues to get deliveries in a reusable bag and not even have to think about recycling that cardboard or throwing away plastic packaging. So all sorts of ways to be thinking and innovating on how to just reduce that plastic use and exposure. You can start big or small. I'm going to add, rebel, rethink, repurpose, reuse, reprocess, recycle, all the re's, and resist the resistance, and rebel and do it. Your break room, get rid of any disposable stuff in the break room. Have staff bring in their own utensils, dishes, share them, their own bottles. Train your staff on appropriate glove use. One hospital saved 21 tons of plastic through glove use training. And in fact, I went to UCSF for an eye appointment, and the technician put on gloves, handed me the occluder to check my vision, took the occluder back, and threw the gloves away. She didn't even touch me. I didn't come in with a big eye infection. It was outrageous. And actually, Dr. Simon Fung from the Department of Ophthalmology and I gave a talk on sustainability and glove use to the ophthalmology staff at the UCSF clinic. So you can do that too. Talk to staff, it's not even my staff. I was the patient. Optimize operating rooms using preference cards, redesign packs, redesign packaging. Try to and purchase things with preferable packaging, like companies willing to deliver in a reusable bag. Replace your disposable gowns and drapes and sharp containers if you can. And again, you're the customer, work with those suppliers. And, just transitioning from disposable to reusable gowns is huge. That can reduce the bulk of landfill waste by 84% coming from the operating room and cut greenhouse gas emissions by 66% from the OR. So really, Stanford's working on this, going back to all cloth and laundered. All the studies are showing it's totally safe and effective. And we want to just make sure we counsel our patients, avoiding plastic cutting boards, counseling them to, try to make sure their tea bags are not full of plastic and glue. The packaged foods, especially meat, it's like if you see this meat here, it's in black plastic, which is the worst. It's heat sealed with more plastic. It's already got a lot of plastic by being an animal product. So also telling them about synthetic fabrics. People are shocked to hear about their watch bands, their fitness watch bands, their yoga pants, and of course, drinking and eating out of plastic and plastic lined containers and never heating them. So a lot of information can be shared with patients from the environmental working group. We have a medical student here featured. Shri is featured doing a cute 1-minute video that can be shared with patients, medical students, anyone. I've got the link here on the slide for her cute video on just household decrease in plastic consumption. And, telling your patients and yourself these personal actions that do matter, filtering your water and vacuuming with a HEPA filter, putting an air filter in your home, taking off your shoes when you get home, finding alternative products. And I say bring a doggy bag. I bring my tiffin to restaurants with me so that if I take leftovers, which I always do because I hate food waste, I don't have to take it in the plastic container they give me. And even if they're giving me a paper container, it's probably lined with PFAS or some kind of chemical to keep it from seeping through. And it's garbage. So I bring my own tiffin, and everyone loves it. The servers love it, probably because they don't have to go back and get a container. People with me say, wow, I'm going to do that. So you can set an example too. And, there's all sorts of products now coming out that are less plastic, water filters, and of course, advocate. And as we all know from Physicians for Social Responsibility, that's what you do. That's what we try to do. So vote, advocate, and share your knowledge and set examples. We know our communities and our patients care. There have been lawsuits about healthcare plastics. I know a paper is coming out, it's under review, that over 90% of patients interviewed at one healthcare system said they really cared if their physician's practice was sustainable. So patients and communities do care. A lot of them just don't know what to do, but they do care about healthcare plastic. And of course, we have many microplastic policies in California. I hope these are all up to date. I'm sure you all know these policies better than I. But California is trying to do a lot, and especially the DEHP ban that is gone on. But I think, it doesn't go into effect for IV bags until 2030 and IV tubing by 2035. That's a lot of people getting DEHP through their IV tubing and bags in the next 5 to 10 years. So I'm not sure why it's pushed so far out, but I feel like it should be made sooner. And again, your own university, your own practice can get tubing and bags that at least don't have DEHP. And we used to have glass IV bottles and glass. You can learn more. You can join our community at Stanford. We have a Stanford Plastic Health and Working Group, which has a lot of folks from all over. It's not just limited to Stanford. So you can get more information about that. Amelia is running that, and you can have a QR code here, but lots of interdisciplinary research on microplastics, innovative interventions and inventions, policy tools. So we have people from the law school, environmental justice working group, local and indigenous communities. It's folks from all over, social science, engineering. So we'd love to have anyone who wants to join up on monthly meetings there. And then PSNAP, which I've joined this national movement, a physician and scientist network addressing plastics and health. It's great. You can connect with others nationally, sharing insights and research. We have biochemists, engineers, lots of diversity there too. Speak with lawmakers and educate your colleagues and patients. They're really set on reducing single-use healthcare plastics and collaborating to create new initiatives. So you can check out psnap.org. They've got fact sheets. Jane Van Dis, an OBGYN, has written some on pregnancy and keeping healthy babies, healthy pregnancies, plastic playbook, plastics in our food, in our infants. So we've got some fact sheets here that are made by physicians and approved by PSNAP that you can give to your patients. And we've got some documentaries out there that may be of interest too. Plastic People is out there. This is about some infertile couples who changed their lives to reduce their plastic exposure as much as possible. I actually met one of the people who made this helped produce this documentary, and they have offered to bring it to Stanford for a showing with a panel. And you could maybe do that at UCSF or wherever you might be, UC Davis, New York, wherever you are. You might be able to get this shown at your institution, and it is on YouTube right now if you want to check it out. The story of plastic is also out there. And so there are things coming out for the general public to really see what's going on with their plastic and healthcare, or their health, basically. So what should healthcare workers do? What should we be doing overall to reduce our plastic and plastic exposure? We need to recognize that low cost and convenience of plastics are deceptive and mask these harms, including both environmental and health risks, and encourage our patients to reduce their use of plastics, particularly unnecessary single-use items, educate them on sustainable alternatives, and inventory our own use of plastics where we can reduce and replace with greener alternatives or reuse things. And, change in our practice, green our operations, our clinics, our labs, our ORs, minimizing that plastic reliance. We've got to all, as we know from PSR, advocate for stronger policies that promote sustainable healthcare practice and reduce this plastic dependence, get regulations changed that make no sense, and enhance our communication with colleagues and leaders about the health risks associated with plastic exposures, and not let the plastic industry get away with saying they're benign particles. So tomorrow's Earth Day. What will you do at home or at work to reduce your plastic exposure? You can put it in the chat, and we're going to chat about it right now because there is no time to waste, and we are all done. Thank you so much for your attention, and we're going to open it up for some things Julie's going to share that you're putting in the chat about how you're going to reduce your waste starting tomorrow on Earth Day, and how we can all reduce our plastic waste. Thank you.
Thank you so much, Dr. Erny. I find it so inspiring that iSustain works in education, policy, with manufacturers, on cost savings. And despite how pervasive plastic is and what a huge, overwhelming problem it is, it's very encouraging to see so many people starting to work on it. So thank you. This was so comprehensive. And we do have questions in the chat. And let's see, what do people say they're going to do for Earth Day? Get those plastic water bottles out of doctors' lounges.
Yes.
Let me start with, there are some questions in the chat. So as people are thinking about what they want to do for Earth Day, let me ask you some of these questions. Dr. Brett Andrews asks, do we know the relative burden of breathing versus water versus food ingestion of microplastics?
I don't know it. But does anyone else in the group know that answer?
If you do, please raise your hand or put it in the chat, and then we can.
I knew this was going to be a tough crowd, and I'm going to get some tough questions.
I also want to point out that Dr. Bob Gold has put in the chat a excellent short article titled "Microplastics in the Plasticine" by Ted Shetler. There's a link for that in the chat. I also want to remind everyone, we will be sharing references and resources and the recording in the follow-up email, but not the slides.
Yeah.
Larry Junk, and excuse me if I'm not saying your last name properly, Larry. He posted that Medical Society Consortium's Climate Smart Healthcare team is talking about a nationally coordinated gloves off campaign, recommending no gloving in any situations where gloves are not needed. We need to talk this up and get it moving. Yes, fantastic. Yeah. I love that.
Thank you, Larry, and thank you for attending from another time zone. I know it's later for you, so I appreciate that and bringing up that.
It is late, and yes. So So far, it is talk. There are individual institutions that have taken this on, but there is not a launch of a coordinated campaign. But it would involve identifying procedures where gloves are not needed. A prototype is a simple inoculation, a vaccine injection should not require gloving. But when I started my career a while back, nobody gloved for things other than private examinations. And these days, people glove for the most unnecessary things, and we need to get rid of that practice.
Right. Like checking a vision with, I mean, it's just,
Wow.
yeah, I mean, it was insane. And I mean, I practiced ophthalmology 26 years. I wore gloves for procedures. And if somebody came in with a goopy, pussy eye, and that was it, and I never got an eye infection, and that I know of, I never spread an eye infection. So, washing hands or using the hand sanitizer it works. It's what we need to be getting back to for sure. And I think, Julie, you had something about, I know you had some questions.
I
There was a
do.
question before about
Yeah.
retainers. Yeah.
And we do have more in the chat, but I'll ask my question now. So we had talked at our environmental health committee meetings earlier about plastic retainers, specifically how Invisalign uses softer plastic. And I asked researcher Nicholas Chartres what he thought about the soft Invisalign retainers. And his advice was to stop wearing it. But as we know, then your teeth move back or can move back. So I talked to my dentist about it, and she was very receptive and is making me one of the older types of retainers that have a harder plastic. They still have some plastic, but they have less, and it's a harder plastic, which supposedly leaches less. And I won't be biting on the plastic, and it has the metal around the teeth. But I'm curious if you, Dr. Erny, or anybody else here has more to share about the changing the materials we use to make retainers.
Yeah, I was happy to find out that dentists are actually working on this. And you can have a permanent wire placed behind your usually bottom teeth to keep them in place rather than putting a plastic retainer in every night. It is epoxied onto your back molars. I don't know what's in that epoxy or if that's better, worse, or significant in itself. There's a lot to learn. We're not dentists, but this is something that affects so many people, wear retainers, mouth guards, things like that, and especially kids. But they are working on some 3D printing of more biocompatible polymers and products that are not as toxic. I think the old one, Julie, might be acrylic, like, quote, medical grade acrylic. And there's some permanent wires, there's some new polymers being looked at. So hopefully our dentist school colleagues at UCSF are working on this, and our other dentists, but we're thinking about in healthcare, but then there are things in other fields that folks are stuck with you might do everything you can during the day to get plastic out of your life, and then you feel like, oh my gosh, I can't let my teeth, I have to save my teeth, and this is my alternative overnight to keep them straight. So, there's a lot of advances plastic has done for us in medicine and dentistry. Probably we couldn't have gotten as far as we have in these fields without it, but now we have to at least do our best to make them the safest plastic possible when there's just no other alternative, and to, of course, have other alternatives, get rid of what we can get rid of, and like Larry mentioned, just stop the madness with using single-use plastics or gloves when it's just completely unnecessary.
Yes. Thank you. Thank you for the extra info. And I encourage everyone who may wear a retainer to ask their dentist or orthodontist about it, because it's a good way to start these conversations.
And most of them don't know, but when you start the conversation, they start thinking about it at least. And then we
I
need our academic institutions to really be studying this and working on it and get the word out.
I had a very happy result. I actually asked my dentist about it 2 years ago, and she was not open to talking about it. And this year, she had learned more and was completely very concerned about it. So, it does, somebody may not listen to you initially, but there's so much information coming out every day about this, that, eventually they may hear you. So,
And certainly in the last couple of years, this has really gotten to the public eye. I mean, these documentaries are out, the news is talking about it. So I think I've noticed at least it's really people in the general public are mentioning, their concern with plastic exposure.
yeah. We have a few more questions in the chat. Do we have any studies showing relative decreased burden from HEPA filtration, water filtration, and going to non-plastic food containers? It's a little similar to the last question, but more specific.
Yeah, I don't know of the specific studies, but they're definitely out there. And then even when I showed Dr. Nadeau's blood sample, and after she changed to a water filter, she had many fewer particles in her blood and fewer chemicals. So obviously that's an N of one. That's just her data. But I do think that it's out there. The data is out there on using these filters and systems to reduce your plastic. And certainly they in the movie, the plastic people movie, they do measure their plastics in their blood before and after they got plastics out of their lives in many different ways. I don't think they narrowed it down to just the HEPA filter or just the carpet or whatever it was, but certainly after reducing their exposure to plastic in their homes and in their lives, they definitely had less in their bodies, in their blood.
And if anybody wants to test their own blood, I posted in the chat some options. We are not advocating for any of them. We're just sharing them as information you may want to use to test your own blood before and after.
Yeah.
Trying to
So
reduce plastics in your blood.
There's some home blood tests out there. They're not offered like at Sutter UCSF. They're not offered in medical laboratories. There are some home tests that are offered. They only measure microplastics, not nano. They're not as accurate as the machines that I showed you that are, the laboratories that are actually researching the plastic particles. They're not as accurate, but they might be useful for comparison purposes. Like if someone is going to test their blood, stop vaping, which I learned today is a huge source of plastic in the body, people that vape. They might stop vaping and then test their blood again with a home test kit. And if it shows a significant change, maybe that will motivate them to, stay that way and to maybe reduce even more plastics in their lives because they could see it's working. So, but I don't know of a lot of actual scientific studies. I'm sure they're out there though.
We have another question. How feasible how feasible economically is it to go back to glass vials, syringes, containers, IVs, etc., with sterilization instead of plastic?
Yeah, well, definitely the IV, the bottles, like IV fluid bottles we used to get in glass. There's a lot of life cycle analysis that has to be done. If the companies have to take them back and wash them, and that's a lot of transportation costs, a lot of pollution from trucks transporting them because they're very bulky and heavy, as we know. So I don't know if the life cycle analysis has been done on that, but you have to compare the transportation of a plastic versus the glass, the effort to wash them with the hot water versus the manufacturing water used in the plastic. So that's where we really need our life cycle analysis engineers to come into the picture. I think the glass vials are certainly a lot less bulky and weight compared to, glass bottle versus a bag of IV fluid. But the vials are about the same size. So, I don't know the answer to that, but those are all things I think need to be studied and studied properly with life cycle analyses, like the laundered gowns versus the disposable gowns. That's huge. I mean, the life cycle analysis are proving time after time that it is, much more green, as we could say, to use laundered gowns and drapes and that the infection rate is not any higher. So we just need those studies to be done and decide what course we want to take. But to advocate for glass, I mean, these plastics, as we're finding out, they have health harms. I mean, we're administering, drugs and saline, leaching plastic into people's blood. So even if it does cost more, or maybe, is not as environmentally perfect, or correct, it might be the thing we have to do for our human health. So it's a big question.
And that was a question from Susan. So thank you, Susan. And we have another question from Mike Martin. With lead toxicity, it took more than 30 years to see the full adverse impact of lead to become, or for the full adverse impact of lead to become apparent. It seems like we are seeing the same thing with plastic. It will take many years to appreciate the full harms of plastic. What do you think about that?
I'm sure that's right, Mike. I mean, it's scary how much harm we're seeing already with it. I don't know why it took 30 years for lead. It now seems so obvious, but of course, the industry is going to fight and dispute anything we do. And I know that article came out in The Guardian about, trying to just people, of course, overinterpreted it as like all plastic healthcare data is all plastic health harm data is wrong, when it was really about, well, is there really a whole spoon in your brain, or is there a spoon and a fork, or is there just a little toothpick? I mean, that was the question in that Guardian article. Like, that was the argument. Like, well, maybe we don't perfectly measure how many particles are in your brain. Well, I don't want any plastic particles in my brain. I don't care if it's a spoon or, like I said, a toothpick. It's there. It's scary, and we know the chemicals harm us. So I'm sorry, I'm not answering directly your question, but I think we've got enough evidence now between the chemicals that have been studied. For those chemicals in plastic, some of them have been studied over 30 years. So it's not the plastic itself particularly that, suddenly getting studied. We have the data on these chemicals. We don't have to prove that the particle itself physically is that harmful. And that may take 30 years before it's proven or believed, but we've got the chemical data now.
Given the early evidence of damage from plastics, it's scary to think of what might be coming in the decades ahead.
Right.
Yeah. There is a comment in the chat that is not a question, but it raised a question for me. Deborah Little, good to see you, Debbie. We've all been told, oh, we should reuse plastic, right? It's better for the environment to reuse it. And Debbie says that she's been reusing Ziploc plastic bags that are 10 years old. But then I think, oh my goodness, if it's 10 years old, it could be leaching more chemicals. And now we know you should not reuse your plastic water bottles. Can you give us more information about, when it's okay, what types of plastic can we reuse, and what types are just creating more health harms if we reuse them?
Well, I don't know any plastic that's safe to reuse because they all break down every time you wash it. I mean, if you do, I don't know, if you're storing potato chips in a Tupperware and you wash it with cold water, are you really, like, is that the worst thing in the world? Maybe you're doing more good by saving the planet, but hopefully you don't even have Tupperware anymore and you have glass containers. People buy plastic water bottles, and I used to think that too years ago, like, oh, I'm going to reuse this because I'm an environmentalist. I don't want to throw it even in recycling. But, hopefully now you're getting more and more of that plastic out of your life, so there's not even a reuse issue. They do sell compostable Ziplocs now. They do sell, and the saran wrap I showed, saran wrap, the equivalent to plastic wrap that's like a much safer biofilm product. Even the Starbucks cups, I was so happy. I went to Starbucks for some reason a few months ago and I saw they had compostable cups. And I'm like, this is great. They've switched to compostable cups. They're safe for the planet. They're safe for me. And then I looked up the lining, and even though it's a bioplastic like PLA, it's mixed with chemicals to make it waterproof. So even that, drinking out of that cup, reusing that cup, there is plastic in there. And even the bioplastics are not 100% safe for us to be ingesting, especially with a hot liquid. So I say, good for you for reusing your Ziploc for 10 years because you saved, the planet. But as plastics get older and older, they break down more and more. So it's safer for you if you're going to use a plastic thing to have it be virgin plastic, but then you have the whole dilemma feeling guilty about disposing it. So as much as you can get it out of your life, use other other materials.
There's another comment that is something I was wondering about because I have an elder in my life who takes a lot of Miralax. Stephanie Bloom, good to see you, Stephanie, says in pediatrics, we use polyurethane glycol, Miralax, chronically for constipation. But I read that the synthesis of polyurethane glycol also creates some ethylene glycol. So we might be feeding patients this plastic that is likely absorbed and concentrates in the brain.
Yeah, I think I thought Miralax was propylene glycol. And it's worrisome. I don't know of any studies out there, but I noticed that a while ago that's the ingredient and the main ingredient, and it's listed, as plastic, as maybe having health harms. So I don't I don't know if does anyone out there know of a study on this? Because it probably should be studied since we are giving it recommended. It's over the counter. It's recommended to patients all the time, and so many people are ingesting that on a chronic basis.
It should have said polyethylene. It's polyethylene glycol,
Right.
and it produces ethylene. Yeah.
Yeah. So
I've just read chemistry studies where you have ethylene glycol as a byproduct, and then we give this to kids for years
I
in their
know.
gut.
I know. No, I've been concerned about that too. So I was wondering, I didn't look up if there's any studies on it, but I would hope so. And I do have a bit of good news though. It's been shown that okra, and especially okra for some reason, and other green vegetables help absorb plastic in your gut. Mike's smiling on this, and he may know more than I do. But if you, and unfortunately, even vegetables now have plastic. Even if you grow them in your own organic garden, they're going to have plastic from the air and the soil. But it's still best to eat vegetables, and they have less plastic than animal products, and many of them help absorb it from your gut. Mike, do you know more about that?
No, I seem to recall if there was another vegetable that also did the same thing as okra, but I can't remember
Yeah,
what
it's
it
a
is.
few. It's a few green veggies, but okra
Yeah,
seems to be the number one.
yeah, and I think plant-based foods, the whole plant-based foods are much lower in plastics than our animal products, for instance,
And most
in
of our
meats in
animal,
particular.
yeah, most meat in the US is nowadays packaged in plastic that's heat sealed. I mean, I don't know if you can still, I don't buy meat, so I don't know if you can still go to the grocery store and have the butcher wrap it in truly wax paper, but even the lining of the papers now are plastic. It's better than being heat sealed for weeks in whatever plastic, but definitely your meat products and fish are just full of plastic plus the packaging, and it just adds up to quite a bit. And I did read sardines and herring are now 10% plastic.
Oh my gosh. Oh,
Yeah. So that we used to think those were the safe fish because they didn't have the heavy metals.
Mm.
So they have more plastic. The big fish have the heavy metals. So yeah, I think eating fish has
well,
gotten pretty
With,
dangerous.
with seafood, it kind of makes sense. They're all filtering the water out, and the water's all completely polluted with
Yeah.
plastics.
yeah.
They're accumulating it as they swim around.
Yeah.
And here's another really good question by Lisa Keller. Are oral capsules composed of plastic? And I assume, Lisa, you're talking about like vitamins and medicine capsules.
Yeah, I think I did read a while ago that they have some type of plastic in them that dissolves in your gut. I don't know much more about it, but I know that you can get I know most plastics have gelatin and you can get vegan capsules, but I don't know exactly. Again, Mike, do you happen to know if the vegan capsules have plastic though, or?
No, I sure don't. I've not looked
Okay.
into that. It's a good question.
Yeah, I don't know the answer. I knew this would be a tough crowd. I'm not going to know the answers to a lot of these, but whether they're out there or not, maybe somebody can be on uh, on the Google or something looking this up as we speak.
Yeah, if anybody, we will send out, as I said, a follow-up email with resources and references. And if anybody finds anything that they think would be helpful to share, please feel free to email it to me. I'll put my email in the chat. I also want to point out, I put in the chat a link to some of you may have seen reports of doubts being cast on plastic research that came out a couple months ago. I think there was an article in the Guardian and a few other places. One of the researchers we know, Nicholas Chartres, who works with researchers in Sydney and at UCSF, did an interview to explain why it was his response to those doubts, and it was a very good response. I put the link to that in the chat if any of you are interested in that. We have just 3 more minutes. Does anybody have any other questions or comments?
Okay, I just got an answer because I decided to check online
Great.
that most pill capsules are made from gelatin or plant-based polymers, not ordinary plastic, but some capsules coatings and pill coatings contain phthalates or other plasticizers used to control how the medicine's released in the body. So I think there's not a hard and fast answer, but if you have to take a medication in a capsule and you have to take it versus you don't have to buy a plastic bottle of water. You don't have to have carpeting in your home. I mean, there's so many, again, none of us are ever going to get 100% of plastic out of our lives. It's impossible now. It's everywhere. It's in the air, it's in everything, but the poison's in the dose, as we know, for a lot of things. And if you need to take a capsule that might have some kind of bioplastic, versus these huge things that you can change to get rid of the real bulk of the plastic in your life and ingestion. That's, don't eat the hamburger, take the pill you need to take. It's kind of we're going to have trade-offs because it's really, but we've got to push to get alternatives and safer, at least safer things to continue our lives in our healthcare industry.
Thank you so much, Dr. Erny. This was such an informative talk. And I feel inspired to do more. I've been trying to get rid of plastic in my life, but this was really inspiring actually to continue to do more and to continue, talking to people at cocktail parties about this.
And check out Plastic People. I mean, and just it's overwhelming to realize how much plastic's just in your home, in your environment. Just it's pretty overwhelming, but then it's encouraging to see you can reduce that. You can make a difference in your life. So hopefully everybody will have a great Earth Day tomorrow and be inspired to do something tomorrow and make this change.
Yes. Thank you so much, everyone, for joining us tonight.
Thank you. Thanks, Larry, for tuning in from so far away.
And Larry, I apologize if I
maybe
said your
others.
name wrong.
No, it's correct.
Okay.
Yeah.
It's junk. Just say it and
Oh, good. I
thank
knew
you
I
for
knew
greeting
I
me
knew a
and for giving a
junker,
great
so
talk.
I thought I kind of went for it. So thanks for tuning in so late. Your time.
It is late here. Good night, everyone.
Take care, Larry. Thanks, Barb.
Thanks for coming, Brett. Thank you.